Is this one live? We're good. Not here. So we're live. People are joining.
Okay.
That's not nerve-wracking.
Hi, everyone. Yeah, welcome everybody. I'm Marcus Rosencrantz. I'm the physician and founder here at Reproductive Health and Wellness Center.
And I'm Cindy Anderson, the nurse practitioner.
And welcome to our LGBTQ night. We set it up as kind of an informal conversation more than it would be like a lecture or a seminar. We have kind of a smaller group here gathered. I don't know online, but we're happy to please interrupt and ask any questions along the way. And Cindy and I together prepared what we would like to discuss, and then just because the conversation informal, please send us questions and we can address those for you. It's so weird just talking to a computer. You really have to get used to that.
You want to get started?
Yeah, Alex, you'll let us know if questions
Yeah.
come up. Yeah. All right. Well, we opened our doors in August, and we are a full IVF center, and we also believe in a commitment to reproductive wellness, so that we give our patients the best chances of success possible. And part of what we want to accomplish here is to be an advocate for the LGBTQ community. I think Cindy and I, working together, both feel very strongly about that and passionate about reproductive rights for everybody. That being said, I think the first thing that I always like to talk about is just the process of reproduction. I think a lot of people just don't know how babies are made. It's something we maybe get in 5th or 6th grade, and for a lot of us that was a long time ago. But I think that helps put everything in context moving forward. So obviously you need sperm, and sperm is deposited into the vagina through intercourse. We'll talk about traditional reproduction for now. And the sperm will make its way through the cervix and into the uterus and into an open fallopian tube. A woman ovulates an egg usually once a month, so the timing of all of this is very important. The egg only lives for maybe 12 to 24 hours. The egg gets released from the ovary, and the fallopian tube will pick up the egg at its other end, and the fallopian tube will bring the sperm and egg together, and that's where fertilization will occur. And then the fallopian tube actually will push that embryo into the uterus, and around day 6 or so, that embryo will implant into the uterus. It's just a ball of cells at that point, and all goes well, then that embryo continues to grow into a pregnancy and a baby. Obviously sperm, eggs, uterus, and tubes, those are the things that we need to accomplish a pregnancy, and so I think that that's a good place for us to start. Alex, do you have one of the agendas?
Yes.
Can you grab me one?
No, it's over there. The one you were touching.
Any questions so far? Okay, biology 101. Okay, yes. All right, so the first thing we wanted to talk about was where babies come from is for female couples. We said on our little agenda here, ladies first. So for female couples, how would we go about this process of helping? And obviously, the big thing is where to find sperm. And there are a few options with that, and I think
I can take over here. So You can get sperm from a couple different places, anonymous sperm banks, places like California Cryobank, Fairfax, Sperm Bank, there is Seattle Sperm Bank, and there's other ones around the country that you can pick. These donors have been pre-screened. They usually take, they say about 1 to 5% of all donors that are actually screened. They'll do a psych eval, legal contract, lab work, and these donors' sperm are collected, they're quarantined for 6 months, and then retested. And so at that point, they're put on the website for you guys to view. They do a thorough history evaluation, so you'll know about their family background, like cancer risk, education, their hobbies, their likes, their dislikes. So there's lots out there for you to kind of choose from. Some of them have pictures as children or as adults, and there's a good amount out there in all different types of ethnicities and builds and ages. The other option you have is to use a known sperm donor. So a lot of patients will come in with a family member, a cousin, brother, sister, or a friend, a coworker that they'll want to use their sperm. So they will also need psych and legal. So it's just a contract stating everything that will happen, and parental rights. Psych, they'll just talk to the psychologist, understand what they're doing, and then we'll do screening as well. So we'll do carrier screening, make sure that you know background if they can pass on any genetic, and also do infectious disease testing. And then we'll do the testing about a week before the sperm is collected, and we can either use it for insemination or for IVF. And so those are the two possible ways using anonymous versus a known sperm donor.
Yeah, and we have patients who get sperm from all over the country, really. So there are sperm banks, like Cindy said, that are all over, and the sperm is flown in a tank, liquid nitrogen tank, so they're frozen and they're loaded up in these tanks that can be as good for as long as for 7 days. So it gives us some flexibility. And we've had people bring sperm in from Florida, from New York, from Virginia, from Seattle, really all over. And so we encourage those couples to look around until they, it's obviously a big decision to find sperm that they're comfortable with. Known donor sperm adds a little bit more complication, like Cindy mentioned, with paternity and paternal rights. And it's not, the sperm at that point isn't quarantined because it's from the live donor. So there's a few more issues that come up with a known donor than they would come up with anonymous donor. But we are here to help patients however they want, and we have couples who really end up using both. For those women couples, once we've selected once they've selected the sperm, there's really what I like to do is if there aren't any risk factors for them, is I really like to start with what we call these natural cycle inseminations. And basically we would do an insemination right around the time that a woman is naturally ovulating. So we don't really use any medications to stimulate the ovaries, and we really try and make this process as easy there as possible. So an insemination is where we would take the sperm and we put it in this very tiny small catheter, and then we deposit the sperm right up at the top of the uterus. So we use a small speculum, we pass that little catheter through the cervix and deposit that sperm gently at the top of the uterus, and women basically will lie there for 10 minutes or so, and then off they go to their normal day. It doesn't hurt really at all. And then in 2 weeks, they'll know if they're pregnant. And so I think that's a reasonable place to start in women who have no risk factors for infertility. Again, just trying to make it as natural as possible. And natural fertility is the success rates are not actually that great. They can be 15, 20%, 5%. It kind of depends on the patient's age. So we like to try that a few times before giving up on that. And then if we're not having success at that point, then there's options of maybe changing the donor, doing an infertility evaluation, and moving on in terms of the other treatments. And to be honest, Over the years of doing this, we've had women who get pregnant on their first natural cycle insemination, and we've had other women who end up having to go all the way to IVF before they were able to achieve their family goals. And it's just one of those things you don't really know until you try. Yeah, I don't think it's not as, we try and make it as natural as possible, not as least scary as possible. And I think when women come in and we talk about doing these natural cycles, they're sort of surprised that, okay, well, that's it, that's all we're gonna do, and yeah, that's it, it's a good place to start.
So you have a question.
Okay,
Can you combine 2 eggs to make a baby?
we can't combine 2 eggs to make a baby, but we can use 2 eggs to make 2 babies. A baby's made from 1 egg and 1 sperm. So, no.
Do you want to talk about female couples?
Yeah. Oh, reciprocal IVF.
Yeah,
Right.
that'll.
Yeah, so there is another option of reciprocal IVF or partner IVF as well. And thank you, Cindy. But sometimes both women want to be a little bit more involved in the process, and so for some, they don't want to carry the pregnancy, but maybe they want to have their eggs used. So some women will go through an IVF cycle, and that's where we stimulate their ovaries and take eggs out of their body. We would mix that with that sperm that they procured, and then we would make an embryo. Once egg and sperm are together, we make an embryo, we grow the embryo, and we put that embryo in the partner. And so that's a nice way for couples to both be more involved in the process. Obviously, IVF is a lot more expensive than just a plain insemination, so it's a much bigger commitment. But it's another great way to go about things. And we certainly have couples who want to do that from the beginning.
We have a couple in our group that did do that.
Did that.
Did they?
Yeah.
We have a 6-year-old now.
And they're happy?
I'm super happy.
Yeah. Yeah. We've had women both get pregnant at the same time with inseminations too, both partners wanting to do it. So yeah, at the end of the day, there's a lot of choices.
You have another question.
Okay.
Does it cost more for twins?
No, it costs more to raise twins, but it doesn't
Yeah.
cost more to make twins. No, anytime we use medications to stimulate the ovaries to ovulate more than 1 egg, that's where the risks of twins come from in multiple pregnancy. So that can happen with fertility treatments, and nowadays that's the thing that we're all so very cautious about and very concerned. We want patients to have a healthy and safe single pregnancy, but sometimes we end up with twins just because of the nature of the medications. But it isn't more expensive though.
In the long run, it is.
Anything else there, Alex?
Nope, not yet. Oh. How long does reciprocal IVF take?
Well, from the time you get started with the process of taking the eggs out and mixing that with sperm and then growing embryos, if we put those embryos right then back into the partner, from the time we put embryos back in, you would know 9 days later. So that's actually would be just about a month from the time you started to the time you achieve a pregnancy. There's a lot of ways that can slow down. Most people would get the embryos and probably would freeze them and then go back to the partner and get the partner ready, as opposed to doing it at the same time, because logistically getting both people on the same time of the cycle can be a little bit difficult. And also nowadays we can do genetic testing on the embryos, and that's where we look for the chromosomes of the embryos to make sure that they are normal and would be viable for pregnancy. And to do that, most of the time in that scenario, we freeze the embryos too. So while we're waiting to hear whether the embryos are actually normal or not. And so I would say yes, it could be a month, but probably with freezing embryos and or doing the genetic testing, you're looking at maybe 2 or 3 months from start to finish. That's a good question.
Is it a good idea for both female partners to get treatment?
Yeah, well, I mean, I think that that's really a couple's decision. Sometimes one person might be a better candidate than the other person. You know, one person might be significantly younger, and that always, you know, helps when it comes to fertility. The younger women are, the higher fertility rates they have. The older they are, the lower fertility rates. So sometimes there's decisions can be made that way, and sometimes one's just not interested in being pregnant. But for couples who are both interested, that's really cool, I think.
That's it. That's
We're caught up.
yeah.
Okay. All right. So let's move on to male couples now.
Male couples.
Yeah. Okay. So for male couples, okay, so we have sperm there. So that's usually not the issue in this situation. Now we need to figure out eggs, and we need to figure out the uterus. So nowadays, the eggs and the uterus are from 2 different people. So we really try not to combine that into one person. That's called traditional surrogacy, where the eggs and the uterus were from the same person. So we would use her eggs, and then she would also be pregnant. But legally, that causes a few issues. So nowadays, we use eggs from a donor, and then we would use a surrogate, or what we would now call a gestational carrier. And so we have to figure out how to get those eggs, how to source the eggs and the gestational carrier. And Cindy can talk to you about that.
So egg donors, again, you can find egg donors through agencies that are anonymous to you. So you will get a profile, again, just kind of like a sperm donor. You'll know their likes, their dislikes, their hobbies, a little bit about their family history. Usually go to an agency to view their profiles online, so you can go on to the donor agencies and view their profiles. And then once you choose a donor, then you will be matched with them. So the agency will put all this together for you. They'll also help you do the legal contracts with the donor, and also psych. So at no time will you ever meet the donor. Everything's done completely anonymous. You just use the agency as the middle person. They will then send us your match paperwork to let us know that this is the donor you have chosen, and then we'll screen them. So we'll make sure we feel that they are a good candidate to donate their eggs, mainly based on age. We like to see them between the age of 21 to 30. We'll do a history, a physical, make sure their antral follicle count, or how many potential eggs we see, is what we feel would be a good candidate to make a good amount of embryos. And then once they're ready, we're going to go through an IVF cycle, as Dr. Rosencrantz kind of discussed earlier. So we'll give her medication to stimulate the ovaries to produce multiple eggs. So with an egg donor, we're hoping to see maybe 10 to 15, 10 to 20 potential eggs in a cycle. We'll retrieve those eggs, and then at that point we'll make embryos. In that time, you can decide whether we're going to fertilize all those eggs with just one female or both of them. So some of them will do 50-50, so you'll have embryos from each parent. And then we'll let those embryos grow, and then we'll freeze them normally to blast stage and get them ready to transfer back into a surrogate. The other option is to use somebody known to you, so again, a sister, a cousin, a friend, that will not be related in any way to the sperm donor. So we would screen her just the same as we would an anonymous donor, except this person is known to you. So we'll still be doing all the testing just the same, the egg retrieval will be the same, but the main difference is they'll be known to you. So it can sometimes be a little more complicated, and you want to have a great relationship with that person. But for a lot of people, maybe it could be one person's cousin or sister, and then their partner's sperm. So it's still kind of all family related, or from an anonymous donor. So either option works. It's just what works best for the couple.
Is egg donation more expensive than sperm donation?
Yeah.
Yes, unfortunately, egg donation is costly because a female has to go through taking shots. It's usually about a 2 to 3 month process. So it is a little more invasive. You're actually not paying, you're paying for her time and all that she has to go through in her injections. But it is more costly. The sperm donors, the vials, I would say maybe run about $1,000. Anonymous sperm donation, anonymous egg donation with everything entails, it can vary, I would say maybe 25,000 or so. And different circumstances can make cost vary.
Yeah, it's just so much easier to get sperm than it is to get eggs. Eggs is, takes a lot of medication, and it's invasive, and it's expensive, and it's a procedure. Well, when sperm is just so much easier and more accessible. We get concerned sometimes from patients about the egg donors. I would say the donors that we meet, 75, 80%, they're lovely, young college-age women. And if we have any concerns, because they're screened, like Cindy said, if we have any concerns, we would share that with you and let you know that maybe there's a better choice out there for you. But in general, you know a lot about your donor, even if it's an anonymous egg donor. You'll know a lot about them, and we also make sure they're good candidates. And in general, they really are lovely women. There is another way to source eggs is through egg banks, and so that's kind of a newer thing with egg freezing. There are women who have already gone through their egg donor process, and instead of their eggs being used right at that time, they are frozen, and you're actually able to go to these banks, and they're just like sperm banks, and you can buy 6 eggs at a time. And so that can really reduce the costs because the eggs are already there and already frozen, that you don't have to compensate the donor. And that's an option. The only thing about egg freezing, obviously, is, like Cindy said, with a live walking around donor, we're looking to get 15 to 20 eggs. So you have a lot more eggs to work with. So that's one advantage. And I think the other advantage is there's a more diversity, there's a bigger pool of candidates to choose from when you're using a live walking around donor. When you're going to the egg bank, because egg freezing technology is relatively new, there's not a huge pool or diversity of candidates. So there's some positives and negatives for both of that. And then just one thing also that Cindy mentioned is, and we've had this too, is that both partners, we get this good number of eggs back from an egg donor, and we use sperm from both partners. And so we fertilize half of the eggs with one sperm and one person's sperm, and then we fertilize the other half, and maybe they know which one, or we surprise you, and we have a pregnancy, the first one, and then the next pregnancy we would know, that embryo is from the other parent. So it's kind of cool also. Again, always lots of different options. Yeah. Gestational carrier?
Yes. So we've created those embryos, and now we need somebody to carry them. So again, there are gestational carrier agencies that are out there to help screen. These surrogates, a lot of them will do home visits. A lot of them will, meet with the surrogate and kind of get to know and see why they're doing. It is a larger commitment with surrogacy since it's the entire pregnancy plus the beginning stages to get you pregnant. So they'll take hormones to get the uterus ready. They also have to take injections through the first trimester to prepare the uterus and have enough supplementation to help the pregnancy until the body takes over. So surrogacy are women usually, again, between the ages of 21 to 40. They've had normal pregnancies in the past, no complications. Most of them will enjoy being pregnant because it is not an easy process for some of them, so they'll want and like the experience of childbearing. So we screen the surrogates, whether you know them or they come from an agency, because you'll get to meet the surrogates, and we do a thorough medical history. We do records reviews, so we want to go through all their records, make sure their deliveries were uncomplicated, their pregnancies were uncomplicated, and then we do a physical, a uterine evaluation, make sure the uterus looks good, some ultrasound and blood testing. And we'll also test the partner for infectious disease testing. Like I said, you can get them from an agency versus somebody that you know that's a friend that can carry for you. But the process is still the same. They'll still be doing psych and legal. The medication to prepare the uterus is estrogen to get the lining to thicken up, and then we'll take progesterone injections to be receptive for that embryo transfer.
Yeah, diet.
Diet. Yeah.
Does it really matter what you eat? And it doesn't say for male or female couples.
Yeah. Well, that's interesting. I'm glad somebody asked. So the question was, what about diet? And one of the things that I mentioned when we started is that we are a wellness center. And the idea of that is that we know that things beyond sperm and eggs and uterus and tubes, have an impact on our fertility success rates. And so it was really important to me that when I started this center that, again, we give patients the best chances possible, and that's where the wellness piece comes in. So we actually have people who come in here and do therapy, they do acupuncture, and they do spiritual direction. We're going to have yoga and meditation soon. But back to your question, is we also have a nutritionist, who comes in to do nutrition consults with patients. And there is some literature that suggests that a healthier diet can help those people be more fertile. So that diet is it's really at the end of the day about eating healthy. So it's things like less animal protein, more vegetable protein, more antioxidants, less trans fats, more unsaturated fats, less fried food, less white sugars, and the big one is a full cup of dairy every day for those of us who are not overweight and can have full fat dairy. So yeah, there are some things that can help, and we're excited to be able to incorporate and integrate that into our patients' care. So thank you for asking about that.
Obesity. That's what they're asking. Does obesity affect fertility?
Yeah, it can. I mean, certainly there's a lot of obese and overweight and obese women and men who achieve pregnancies without any issue. But the concern is with more weight is you have more estrogen around in that fat. And that estrogen can interfere with how our brain and our genitals interact. And so that high levels of estrogen can affect sperm production and can affect ovulation and egg production too. And there is some data that says that those estrogen levels can also affect the uterus and implantation. So I think it does play a role, and so we always talk to patients about weight loss. Certainly there's also more complications in pregnancy with obesity, so the risks of pregnancy itself are going to go up. It's always hard though, as patients get older, it's not like time is also important, and so we have to balance these things like weight versus time. So yes, we would like patients to be normal weight, or at least not in the obese range, but sometimes we don't have the time to wait, and we're here to help patients no matter how they come in. That's also a very good question.
Good information. I think I'll wait if this is about hormones. So
Sorry?
It's about hormones, but I think you're going to cover that topic next, right?
Hormones, like patients on hormone replacement.
Oh, for
Does it affect their fertility? It just says hormones. Does
Hormones.
taking hormones affect fertility?
Do taking hormones affect your fertility? Yes. The same thing like we were talking about with obesity, and when you have more estrogen around, that can affect sperm in men, that can affect eggs in women. And so the same thing, if you're taking hormones, either from prescriptions or over-the-counter things, those can, in a similar way, affect. So estrogens, testosterones, progesterones can all impact what's going on with your ovaries and what's going on with your testicles. Marijuana, good one. Okay, so
All it says.
yeah, no, totally, especially here in California. So marijuana has and is still considered like smoking, and so I don't know what happened. Are we good?
Yeah, we're still on IG. We'll,
We lost Facebook for a minute.
for a minute, we'll get back on.
If you want to continue, it was on IG, the question.
Oh, goes back to wait though.
All
Sorry,
right.
we'll get back to it. We'll just have a sip while we're waiting.
Do you have any questions?
No, it's all very interesting.
Lots of
Isn't it
information.
fun stuff we do?
Yeah. And boy, is it so expensive.
It's so much
It
more
is
difficult,
expensive.
right? In general, they have
Good.
And we are back on
Except
Facebook.
for this. Okay, so marijuana. So we've always considered it to be, and still do consider it to be like smoking. So smoking in men and smoking in women is bad for reproduction. Smoking can cause all the things that we look at in the sperm to be worse. So when we look at sperm, we look at how well they're moving, how good they're looking, how many there are. They're all negatively affected by smoking. For women, smoking has been shown to make it more difficult to get pregnant, to increase the risks of miscarriage, to increase the risks of a pregnancy outside of the uterus, which is called an ectopic pregnancy. So, and it can actually increase menopause by a year or two as well, because it's pretty damaging to the ovaries. Now, the reason marijuana is a little bit more interesting is because marijuana is not really nicotine, and so there was a more recent study that looked at marijuana and said that, well, maybe maybe there isn't such an issue, and that marijuana is safe for people who are trying to get pregnant, and marijuana is safe for people who are pregnant. So in response to that study that went national, our American Board of OBGYN and our American Society of Reproductive Medicine both said, no, then that the advice has to be, until we know more and until there's more studies, that we have to continue to say that marijuana is not safe in pregnancy and not a good idea for people who are trying to get pregnant. So that's going to continue to be our advice. Great question though.
This isn't really a question, but several comments on your socks.
Okay. Right on, were those just for tonight? Shout out to Stance. I love Stance socks, and these rock. Thank you.
Okay, next question's about transgender. Did you want to get into that, or
Yeah.
you more on gay couples?
No, let's
I
go
see any
ahead. If
questions.
there's more questions that come
Does
up.
anybody else here have any? No?
So when we talk about transgender men and women, I think for this, we're going to refer, try to be sensitive, we're going to refer to biologically male and biologically female. So we're talking about the reproductive organs that you're born with. And so trans patients have a unique set of circumstances because they usually are going through hormone treatments and some also gender reassignment surgery. And so both those hormones and surgery can have an impact. So for trans men, before you start testosterone, we would recommend, if you wanted to preserve fertility, going through egg freezing, which is where we would take eggs out of your body, which is similar to IVF. So we use injections to stimulate your ovaries, and then we take those eggs out, and then we can freeze those eggs for the potential to be fertilized later, or if you have a partner that has sperm, we can make embryos out of them right then. Obviously, you would need a uterus at some point to be able to carry that pregnancy. So if you have your ovaries and uterus removed, then you would need to have a gestational carrier. Once you start testosterone, that can really be an issue for us to be able to get eggs. And so that's really going to suppress the ovaries and potentially high dose testosterone like that can potentially, the ovaries might not ever recover and might make you sterile. So we could try and have you come off of testosterone and reassess where you are with the ovaries, but it's always better to do it before. Yes?
What is the earliest age that can happen? Because it's really important for a trans person to be on that, medication, testosterone. So what's the earliest age to be able to take eggs or sperm?
That's a great question.
Yeah.
I mean, I think there are, that's interesting because it kind of overlaps with kids potentially who are going to be having
That's what I'm talking
chemotherapy,
Yeah.
or kids who are going to have some sort of radiation that could also damage their ovaries and sperm. So, I mean, we've had boys as young as 13 or 14
So the
potentially.
puberty age?
Yeah, I mean, you have to be able to ejaculate.
Right.
You have to be able to ejaculate. You have to
Right.
be able to have sperm. So, and then for ovaries, these procedures are transvaginal. So we have to, be able to put an ultrasound probe into the vagina, which can be an issue for younger girls. So certainly 18 is adulthood, right? So that's less of an issue.
Right.
So younger than that's obviously a family decision, but there's some things that we have to, we technically need accessibility. So those girls would have to be if they're using tampons at that point, then they usually can handle that. And you could do it earlier, but puberty, yeah. Good question though. Yeah. Okay.
The girls also have to be ready to take daily injections, so they do injections for about 10 days, and they do 2 to 3 shots a day. So along with having to do the ultrasounds, they also have to do injections and be ready for that. So
It's a process.
it's going to be an age, and I think per person.
Right. So for trans women, always again it's going to be the same thing, that freezing sperm prior to starting your hormone therapy. So prior to starting high dose estrogen and those androgen blockers, we would want you to freeze sperm. Once you're on those hormones, we can try and have you come off and see, as long as there are still testicles there, to see if we can get sperm. But sometimes those hormones, just like we talked about, can cause permanent sterility, and there might not be able to get sperm again. So at the end of the day, everything's better to do before those high dose hormones start.
What is the process for a transgender male to get pregnant? First, I guess a good question would be, can they? But that's their question.
So they.
Female to male.
Yeah. So right. So we would need eggs, and we would need sperm. So hopefully that person is not on high dose hormones at this point, or they've already frozen their eggs. But essentially they would go through an IVF cycle where we would take eggs out of their body. We would need to mix them with sperm to make embryos, and then we could potentially put embryos back inside the uterus, assuming that the uterus is still there, but no high dose testosterone for any of this.
Can you freeze your eggs during treatment?
You have to come off of treatment to be able to get to eggs or to get to sperm, and can be really hard physically and mentally for those patients. So it's really needs to be done before treatment starts. The other choice is to stop and see, but sometimes those medications again can cause permanent sterility. So sometimes you can't go back and get eggs after you've been on high dose testosterone, and you can't get sperm after you've been on high dose estrogen.
Are there any cases of trans women getting pregnant?
Trans women.
So men to
They would
female,
have
I
to
believe.
be, no, like a uterine transplant.
No.
So there's no known cases?
No. People are starting to do uterine transplants, so there are a few cases of that, but that's for people who have already had a uterus. So I don't know if the anatomy would be there in the right way to be able to do that in a trans woman. And they're having some reasonable success in terms of achieving pregnancies with those transplanted uteruses, but maybe that's a little bit of medicine for the future.
Talking about tube time, can it be reversed?
What's that?
Tubes?
Tubes time.
Yeah.
Can it be reversed?
Like,
Yeah, it can be. It depends on how so we got a question about tubes being tied. And so that's a procedure where somebody had part of their fallopian tubes either clipped or removed. And so it depends on how the surgery was done. There has to be a certain amount of fallopian tube there left to be able to put that back together. Sometimes it is possible. It's always sort of a debate whether those patients should just really go straight to IVF, where we have eggs and sperm in the laboratory and we don't have to worry about them meeting in the fallopian tubes. And so that would be the other option. And there are advantages and disadvantages to both. But tubes can be put back they can at least be attempted to be put back together, but it's not always successful. That's part of the disadvantage.
for female couples, at what age is it not safe to do IVF?
So so the American Society of Reproductive Medicine is really 50. I think it's 55 now is the cutoff for pregnancy.
Wow.
So I certainly, as you get older, carrying a pregnancy is more challenging, and all of those risks that women have during pregnancy are all going to be increased. So the risks of preterm delivery, the risks of needing a C-section, the risks of gestational diabetes, the risk of high blood pressure in pregnancy, all of that goes up as women get older. And so we can do pregnancies in women who are older like that, but there are definitely increased risks. And when you have to be a good candidate also, medically and stable, and pregnancy adds a lot of blood volume to your body, so your heart has to be in good shape as well. But 55 would be the cutoff here.
Does chemotherapy affect fertility?
Certainly does, yeah. Chemotherapy does affect fertility, it can affect fertility in both men and women. And California actually just passed a bill that mandated infertility coverage and IVF cycles for those women who are about to start chemotherapy. So I think that bill is in effect, and so insurers have to cover that now. Obviously, if you're a male, it would be nice to bank some sperm. Can affect your fertility. Just because you go through chemotherapy does not mean that you're going to be infertile. There's a lot of considerations based on the age at the time you underwent chemotherapy. Also, the chemotherapy regimen also will have a big impact. So it's not a straight answer, and it really depends on the situation and each individual patient. But always before chemotherapy, if there's time, and sometimes unfortunately there isn't, but if there is time, if we could bank sperm or bank eggs, that would be great.
time, a couple days. Women have to work harder at it to create eggs.
So the question was whether men needed to take medication to get sperm, and usually not.
That's the easy part.
They usually need it. But yeah, they usually need a few minutes, and then that's it. Roseanne? Okay. Alright.
Can I ask both of you what your passion is of helping the LGBTQ community do this? Did you?
You know what, I think that everyone that wants to have a baby deserves to have one, and I think, a lot of it has to be with knowledge and empowering people, because a lot of people don't know that they're able to do this, and that we're here to help them. I think it's great to be able to, channel our services out to everybody and who wants it, because I think anybody, most people deserve to have that chance, so.
Yeah, and I've always been passionate, kind of like how we started, I've always been passionate about women's health and passionate about reproductive rights for people to make their own decisions.
Yeah.
And so that's kind of what drove me into OBGYN and then drove me into infertility. Yeah. But I think it's part of your core, right? It's how you're raised and the values that you have.
Yeah.
Yeah. So that's part of my core. Anything else, Alex?
Trying to see,
Maybe.
it keeps a little wheel and then it updates. It looks like we have one coming in.
There might be another question, so. You guys had great questions. Thank you for partaking and coming on and being active participants. Hopefully it was helpful.
So you have a question and I'm trying to understand it because it's coming in. So I guess this couple is male and then a female that was men to trans. What options would they have?
Say it again.
So this is a male
A male.
is as the husband and a trans who's now a woman. What options do they have?
So.
Does that make sense? The question?
Yeah, and I think so. Again, you need sperm and you need eggs and you need a uterus. So we could use sperm. If it was before hormone therapy, we could potentially use sperm from both partners. But then we would need egg donor and we would need a gestational carrier.
Well, you have a lot of thank yous and the continuation on your socks. Our most popular topic. I keep scrolling through and
I knew I put these babies on for a reason. Yeah.
One thing I can say to you is, in the time I've worked with Dr. Rosencrantz and Cindy, as a gay male, they enlightened me with so much education, and I can tell, not just with the LGBTQ community, but in general.
Well, in general, yeah.
And I thought I knew, and there is so much I've learned from them, and I can definitely tell that it's not about who you are, it's just that you're a person, and it's something that biologically we want, whether we're gay, whether we're straight, transgender, lesbian. I mean, it's something I think we all want to have,
Yeah.
whether it be by adoption or by nature, and I mean, I feel very lucky to have them on my corner.
Thanks, Alex. Yeah, we're really passionate about what we do. I'm so grateful for Alex being here with us and for Cindy coming to join me on this adventure together. And it's been great. And so we are here as a team to take care of you. And if you would like to come in, we'd be happy to try and help you in any way that you would like.
What's our egg freezing event? Because you
Oh
covered
yeah,
a lot.
right.
So
So we're having another night about elective egg freezing, and that is
on the 19th,
on November 19th, and that will
6
be
p.m.
6 p.m. here at Reproductive Health and Wellness Center, and also online, right? So
Correct.
we'll be streaming on Facebook and on Instagram.
It's our first egg freezing party.
And that'll be our first egg freezing party, so I'm happy to have you. If you come in, we have water, we have some snacks, and it'll be nice to meet you. One thing that I really appreciate about what we're trying to do here is our wellness piece. We're also really, we're small and we're boutique, and we have a nice personal relationship with our patients. There's a lot of IVF centers certainly to choose from. But it's our commitment to you to be there for you at every visit when you're here, to know you, to know your story, and not just be there for you at the beginning and at the end. And so hopefully, again, this was enlightening, and we appreciate you guys taking time out of your evening. Thank you. Thanks for the compliments on the socks. Love it.
Good night.
Good
Good
night. Call us with questions.